Hello, my name is Yi Zhang, and I'm a professor at Institute of Automation, Chinese Academy of Sciences, leading the China-UK Research Center for AI Ethics and Governance in here. And also I'm the director for the Research Center for AI Ethics and Safety at Beijing Academy of Artificial Intelligence. I think this is really a great opportunity to attend this forum because I think the dialogue between East and West on AI ethics and governance is really essential for the future of AI and also for the future of human-AI symbiotic society. As I think it is really complementary to have different cultures and backgrounds to discuss AI ethics and governance, and actually to complement with each other on ideas to create the joint future. We have a paper very related to what we've been talking about in here, is how to cooperate between East and West for AI ethics and governance. That is to overcome the barriers to cross-cultural cooperation. We've been very looking forward to your comments and cooperation. For the topic today, I would like to focus on data and AI governance for COVID-19 perspectives and observations from China. I think there are many ways that you can use AI to fight against COVID-19. For example, you can use it for automated CT image recognition. You also can use it for drug discovery and also automated surveillance. Well, the challenge would be very different. For drug discovery, you have to make sure that the knowledge itself is correct and also the inference procedures. Well, for automated surveillance, the technical challenge would be explainability for deep learning. And also many of the other challenges would focus on privacy and ethics. This is the focus for today. I think for the COVID-19 pandemics, we really need a new infrastructure for public health emergency management systems. Well, in the old days when we were talking about AI ethics and governance, it's always related to patients and doctors. Well, during this pandemic, it's really extending the stakeholders in many ways. For example, we have different levels of governments who has been involved, and also various AI companies, and also community and blog staffs, gatekeepers, even volunteers, that they have access maybe to your personal data. So they're working very hard. We should give them big thank you, but clearly not all of them are behaving according to the current policy. So much more stakeholders have access to personal data now, but actually are they taking the responsibilities for controlling and release and the use of this data? So this is the question. Or in Shanxi, leaking the personal privacy for closely interactive persons have been given administrative punishment. And also the deputy director of Health Bureau of Yiyang District in Hunan province was investigated due to leaking the privacy of COVID-19 patients. So in China, we have a multi-ministry coordination framework to fight against COVID-19, centered by the Cyberspace Administration of China. And there are many ministries who have been involved to releasing the policy as a joint effort that include the Ministry of Transport, National Health Commission, Ministry of Industry and Information Technology, and also Ministry of Civil Affairs. Starting in January the 30th, the Ministry of Transport released the first document related to data and AI governance for COVID-19, followed by National Health Commission, and later the four ministry jointly established the information construction and application guidelines for community prevention and control of COVID-19 outbreak. Well, in that, it clearly indicates that the need to collect information of community residents should be clearly prompt to the community residents and obtain consent, clearly used for the prevention and control of the virus. For other purpose, must reobtain the consent of the community residents themselves. Well, this became a global issue, of course. Now we have more than 200 countries who have been experiencing the COVID-19. Well, at least 63 countries and regions has been published privacy and AI governance related documentations. Well, facial recognition has been augmented in many ways during this pandemics. So this is why we have an interest to investigate on the facial recognition technology and their relationship to public health, especially during this pandemics. If you're interested, you can download the report here. Well, more than 1,000 participants has been involved in this study. And all the participants are actually from different provinces in China. The survey covered all the provinces. We also have participants from 10 other countries, but basically who are Chinese users. Well, the result is very interesting in a way that when you ask that the augmented facial recognition technology, is it effective to help to cope with public health crisis? Well, more than 80% of the people think that this could be effective, and more than 70% of them feel they are effective. Well, they also think that, for most of them, they also think that the current scenario of facial recognition technology in helping to address public health crisis is appropriate. On the other hand, people feel that really people are scared, I would say, because when you ask the question, in order to prevent a similar emergency outbreak after a public health crisis, the collection of facial information in public or in private spaces should be continued. I was thinking that maybe people will not really like the idea, but actually that there's only 13% who said disagree, and for public places. And for private spaces, it's still only 27% says disagree. Well, that means people are really scared. And also, when you ask, after public health crisis, the application of unnecessary facial recognition should be reduced. And then, actually, almost 30% says they're neutral or disagree, or strongly disagree. That also shows that people are actually scared by this pandemics. They hope to use this kind of technology as an augmented technology to keep us safe. But they also feel that after the pandemics, it will be really good to destroy this data, no matter it is at the government or at the AI industries. So people do care about the privacy even during this pandemics. It's not that you can have more access to their private data, ignoring the ethical concern. They are concerned, and they hope that the data could be destroyed after that. If you are interested in the question that we ask, you can go to this Google form to explore. Now we come to the health code. It's everywhere in the world now, but in China, we do collect more information compared to the tryings in other places. For example, if you're using the health code, you have to be verified this is really you that is using the cell phone, so that you can confirm this is really your data. And also, the national ID card is asked, so to ensure that exactly this is you. I think we're doing the tries on the way of trade-offs between privacy concern and effectiveness. Many of the tries could be really good from the ethical point of view, but actually, are they effective? That could be a challenge. But when the pandemic is really ending, and then there are ideas that people say that, well, maybe we can extend the use of this data to migrate it to a normal in a normal cases that is used for healthcare management. Well, then that's the question. Well, we should never try to use collected information for COVID-19 pandemics for other purposes without any informed consent. So it is proposed that it can be used to gather physical exercise, drinking, smoking, or even sleep data to keep you healthy. But the idea is actually not welcome in China. As you can see in here on the website, there are more than 8,000 people says, well, no, we don't like it. So the proposal says, well, that's just a design idea, and currently they do not have plans to launch it. So I think we need to focus on the long-term impact for abuse of AI. We need to ask the question, what kind of AI are we creating for the next generation? I personally very don't like the trying for facial and emotion recognition in the classrooms, because I think it's fundamentally changed the way that teachers and students are interacting with each other. And also, if people go to college and then they will say, oh, this is the AI that is always on me for 18 years. And now when I go to the college, you want me to learn it as a profession? I think many people will not really like it. Well, similar things will happen to health code for life. That maybe when our child grow up, they will ask the question that health code for life that can be accessed by someone else, even before I understand what is informed consent, I don't think they will like the idea. And there could be technology as a revenge. People can say that, oh, I can create a technology that will save us from AI surveillance. So this is the real concern for the next generation, which definitely needs more discussions. And this is why we're pushing the AI ethical principles in China last year. Firstly, as a consensus from scientific community and industry as the Beijing AI principles, and then a month later that we released the national governance principles for the new generation artificial intelligence. Although it is not designed to be, but I think AI to fight against COVID-19 is a concrete example for agile governance of AI, where we do see that the need and the actions for multi-stakeholder coordination among industry, academia, governments, and social services. So we need these principles in the whole life cycle for implementation of the AI services. I think as a concrete example, the COVID-19 contact tracing ethical concerns could be basically mapped to the domain independent AI ethical principles. As you can see here, it covers most of the topic. Last but not least, I would like to say that keeping AI as assistance, not making decisions for COVID-19 is really essential in any circumstances, because for now, in my mind, that AI is actually doing something which seems to be intelligent, but actually maybe the technology itself don't really understand and explain this data in a more clear way. So we need to keep them as assistants. Thank you very much.